Hi, Dr. Jim Carlson here from the Grove Animal Hospital and Holistic Center. We're going to be discussing case number 01951. And we were concerned about lymphoma in this case. So as we talked about the other day, we want to look for the underlying condition related to the lymphoma. And so IHC gives us a baseline look at where we need to go to start conditioning. So going to base point readings, anytime we see cancer in the system, we're looking for the warning points in red, which the lower part of the intestinal tract represented is the large intestine and small intestine. And so the lower part of the small intestine is for the nervous system and also for the immune system. And then we do see some allergy points. And then finally, on the weak side, the thyroid and connective tissue. Connective tissue is really important because weak connective tissue reduces the amount of muscle flexion. And that muscle flexion is important to move lymphatic fluid to the lymph nodes to be cleansed. And so if that lymphatic fluid isn't cleansing, we know that lymphoma is related to the lymph nodes. And so it's affecting the lymph nodes by causing cell mutation. So we have to do something about the lymphatic toxins, and that appears to be coming from the lower part of the body, mainly because of weakness. If we look at the stress side, we can see that lymphatics of the 5 tonsils is called the lymphatic system, where all the lymph fluid congregates between the shoulder blades. And then LY2 is the tonsil. And so the tonsils in the head is another zone where we can see invasion of pathogens, whether that's allergies, virus, or bacteria, or just chemical. Those things that circulate in the lymph fluid can create the mutation that leads to lymphoma. So we're starting to see kind of the pathway of where we're going. And the endocrine system on that side was the adrenal, so there's some stress function that's putting a little pressure on the thyroid as well. And so we want to correct that to bring up the immune system, to make it a little stronger, to help us balance it out to fight the cancer. Okay? So step 1, hemp oil infusion. We want to condition this for 3 months. That's really important to have the body conditioning itself to get well. Number 2 is that we're going to use a herbal formula to balance the immune system. It's called Wei Qi Booster. It helps to balance out, especially the natural killer cells, to do a little better job of clearing out cancer cells in the body. Diet is going to be as few preservatives in the diet as possible, up to a raw food formulation, which is the least amount of preservative and the least amount of processing that she needs to do to get that energy into her body. And then as far as exercise, making sure that we have light, steady exercise, but plenty of ground time, which means touching the earth, getting some of that negative energy out of her. And so the earth is negatively charged, so it pulls some of that cancer energy out of her. And it also helps to clear the mind too. And B12 will be an important part of that. So once a month she gets a B12 injection to help that process along. So step by step we're going to make it to that first hurdle, which is going to be 3 months. In the meantime, if there's any urgency, we're going to try to control the cancer itself with a corticosteroid. We can even talk about oncology as far as how do we manage it if it's advancing ahead of her conditioning. So you want to stay in communication with me on how she's progressing on a regular basis. So call us here at the office, 847-541-4005, and schedule a consultation or recheck evaluation. Otherwise, the B12 shots can be given by technical assistance in the office here, and we can take care of that for you. But get all of your questions answered, and we'll help you through this. Thanks so much.